Hi, my name is Francesca Cattone, and my project would have been starting a group therapy for chronically ill adults at Erie Family Health Center, where I did my internship. The purpose was to start a support and psychoeducational group for patients with chronic illnesses. Being at a site where we get our client referrals from physicians, I noticed that a large percentage of patients are suffering from chronic illnesses such as diabetes, fibromyalgia, thyroid issues, chronic pain, just to name a few. These issues can be interconnected with psychological issues such as anxiety disorders, depression, PTSD, OCD, and many more. And teaching them the connection between chronic illness and mental health and healthy coping skills can be both healing and informational for clients. Many patients are also experiencing loneliness and do not have a strong support system, which makes bringing these patients together crucial in both their physical and mental health. When starting this idea, I wanted to find literature that helped me figure out what was beneficial for groups like this and what would be helpful. According to this specific research study, 35.5% of the patients showed a response to group therapy 1 year after therapy termination. With regard to intervention type, 37.9% of the patients in the cognitive behavioral therapy group and 32.7% of the patients in the supportive experiential group showed reliable change in fear of progression after 12 months. This showed me that both cognitive behavioral therapy and support groups can have a positive effect on their fear of their disease progressing, which is something that I wanted to discuss in this group. This next research study examined interpersonal relationships in people with Crohn's disease, one of the many chronic illnesses that exist. They found literature that explained that many people with chronic illnesses can become socially isolated, which can lead to poor psychological well-being, which is something that I saw in my own clients at Erie. The study explained that to counteract the social isolation, it is important for patients to reevaluate their expectations of themselves, their relationships, and life pursuits. This reevaluation can cause some psychological distress. However, long term, it can be more attainable and become less distressing. This idea can be matched with the idea of grief some clients with chronic illnesses can possess. It is difficult to make those realizations, and sometimes people grieve their healthy bodies and their life before becoming ill. I thought this was really important to talk about in the group, and it was definitely something I wanted to add in. This next study particularly examined stigma, which is another aspect that I saw with clients that had chronic illness. A lot of them had frustrations around healthcare and talking to doctors and things around that matter. So I definitely wanted to try to find something around stigma and quality of life. This study explained that people who have been diagnosed with chronic illnesses report more social rejection, more workplace terminations, and poorer health. This discrimination can even go further where patients anticipate this stigma, which is the belief that prejudice, discrimination, and stereotyping will be directed at the self from others in the future. This anticipated stigma can weaken the physical and mental well-being of people living with chronic illnesses. This next site goes into further about how depression and chronic illnesses are interconnected. This website explained the use of cognitive behavioral therapy when working with people with chronic illnesses. The goal of CBT among patients with chronic illness is to reduce symptoms of depression, which is incredibly common, by targeting the client's view of themselves, their interpersonal interactions, and their fear of the future. This next site is actually a book that I found on how to cope with chronic illness and the depression that comes with it. When people with chronic illness become depressed, it can become difficult for them to maintain productive self-care routines, which could benefit their chronic illness. This book uses principles from CBT to help incorporate a Life Steps module, which will help clients with their medical regimens, organizing appointments, and communicating with physicians, which is something that I thought was very much needed in this population. It also explains behavioral strategies for managing depression, such as participating in pleasurable activities, adaptive thinking, problem solving, and relaxation practices. Once I read this, I definitely wanted to incorporate it into my group. The population would have been both female and male adults. I believe this would be the target population because most patients that have these chronic illnesses are usually a bit older in age, and I believe we would get the most interest from these adults. This population also makes up most of the patients at Erie that are chronically ill. The group would have had no more than 10 participants. It would be a closed group. I believe this would have been easier for the clients in the group to get to know each other better and begin to formulate trust. The age group would have been 18 and over. I anticipated that most of the participants to be in their 40s and older from what I've already seen at the clinic. I would also like the group to last 6 weeks and an hour each session. I would have liked to focus the group on social support, mindfulness, psychoeducation surrounding chronic illnesses and its connection to mental health, healthy coping strategies and lifestyle choices, and grief and acceptance. Many people with chronic illnesses can feel grief towards their old healthy bodies, which is something I believe is important to address. With these goals in mind, I would like to use cognitive behavioral therapy interventions to help focus on fear, interpersonal connection, and lifestyle adaptations. There were 3 assessments that I wanted to hand out when working with this group. The first one is the group readiness questionnaire, which asks how someone feels working in a group. The next questionnaire would be the group questionnaire, which asks about personal experiences in the group. The last questionnaire that I wanted to use was the outcome questionnaire. This questionnaire asks about different symptoms and experiences of the client. This questionnaire would specifically tell me how the group worked for that client. Well, I didn't have any results because I wasn't able to start this group. At the end, I would have compared the group readiness questionnaire to the outcome questionnaire. This would let me know that if the client was ready to participate, maybe their outcome questionnaire would have had a more positive score. I also would have compared the group questionnaire at 3 weeks and again at the end of 6 weeks. I wanted to do this in the middle and at the end because I wanted to know if I needed to change anything in the group to help the clients. This would let me know if there was any changes that needed to be made in order to be a successful group. And these are my references. Unfortunately, I wasn't able to start this group, but I'm hoping one day I will be able to. And thank you for listening.